investigation into 26 clinical trials into the use of
now involve people who've taken huge doses.
The jury's still out on ivermectin, a livestock wormer.
But the demand has led customers to seek out the FDA has to warn people not to take livestock dewormer.
It's 2021, and the pandemic is still a major part of our everyday lives. By now, you might assume that the COVID-19 pandemic is an anomaly in human history. Well, you would be incorrect. Pandemics have been around for centuries. In fact, the most deadly pandemic to date is not the COVID-19 pandemic, but rather the Spanish flu pandemic of 1918 that impacted around 100 million people. The difference between these pandemics is the access to information. Currently, information is mainly spread through social media sites and online articles, where not enough is being done to combat the spread of disinformation. Nowadays, anyone with access to a social media app can spread science information that may be incorrect. It's almost like a disinformation spiderweb that continues to grow and spread the longer it stays. Let's take a closer look at this pathway. Usually, research is published containing complex concepts and an abundance of jargon, yet it may have an attention-grabbing title that draws journalists and columnists that don't necessarily have a background in science. They then write an article in a second-hand news source, which cherry-picks the shocking points without making note of the limitations of the study, the methods used, and the specific population studied. These sentiments are then picked up by certain groups and people on social media apps and websites, and then spread to thousands of people worldwide. We are going to be looking at this phenomenon through the lens of ivermectin, a drug that has not been approved by the Center for Disease Control or the Food and Drug Administration as a treatment option for COVID-19, but has been used by some members of the population. First off, what exactly is ivermectin? Ivermectin is an anti-parasitic drug that is mainly used in animals but also serves a very specific function in humans. Recently, it has gotten wide media attention since many people are using it for unapproved purposes with the hopes of treating COVID-19 infections. Currently, the Food and Drug Administration has only approved the use of specific human-grade ivermectin in the form of a tablet or a topical treatment. The tablet form can be used for two specific intestinal disorders caused by a parasite. The topical form is used to treat external parasites such as head lice and certain skin conditions. It is important to note that humans can overdose on the aforementioned forms of ivermectin. Overdosing can cause nausea, vomiting, diarrhea, seizures, and even death. The drug can also interfere with other medications such as blood thinners. The animal-grade version of ivermectin is approved to treat heartworm disease and specific internal and external parasites in horse, cattle, and sheep, among other animals. To reiterate, the FDA has not approved the use of ivermectin for COVID-19, yet many conversations online have touted their support for using the animal-grade medication for treating COVID-19. This is very dangerous as the animal grade of ivermectin is highly concentrated as it is used for large animals that can weigh sometimes over a ton, such as horses and cows. Thus, even taking a small dose can be highly toxic to humans. Additionally, the animal-grade ivermectin medication contains many inactive ingredients that have not been tested for humans, so the way it may react to humans is unknown. The drug also contains some active ingredients that are ineffective in humans. Now, you might be wondering, why would anyone want to use ivermectin to treat COVID? Well, we were able to interview an individual that used ivermectin to treat her symptoms of COVID-19. This was our conversation.
I heard about ivermectin through personal experiences on social media from those that had used it before, and it worked. They sent me a site to get ivermectin from, so I texted them. I talked to the doctor and she prescribed this for me. 6 hours later after I started using ivermectin, and I felt 100% better. My oxygen went up to 99 and I did not feel short of breath. I had energy for the first time in a week. Ivermectin is an approved and safe treatment deemed by the FDA for other diseases. So if the medicine is safe to take, then why would it be an issue for COVID? And I would tell others, it literally saved my life.
There are some troubling but very common viewpoints in this sentiment. First off, this individual trusted the input from people on social media. There are no safeguards in place to verify if individuals are being truthful regarding personal experiences online. This individual also made it clear that she did not consult her doctor before ordering the medication, which could have led to serious complications. The individual also did not get the medication from a verified pharmacy, but rather through an online website that did not disclose their location or where they themselves purchased ivermectin. In a follow-up question, the individual admitted that she did not certify if the so-called doctor she spoke to had a medical degree and was authorized to do online consultations. Although this individual did notice changes in her health, she did not disclose what other treatments she was using at the time or how long she had COVID. Thus, her health changes could have been due to other variables and/or the medication could have acted as a placebo. The most concerning point the individual brought up was the FDA approval. The FDA approved the human-grade version of the drug for the use of a parasitic infection, not one caused by a pathogenic virus like COVID. Also, it is unknown if the medication she received was even human-grade or if it was the animal-grade version that others have used and the one that's usually advertised as a treatment. Regardless, the FDA has stressed that ivermectin is not a proper treatment for COVID. Although there's a lot to further unpack from the statement above, we want to focus on the starting point, the moment an individual trusts social media and other platforms to inform them about their health. With a quick Google search, many articles speculating about ivermectin as a treatment for COVID-19 can be found. However, these online articles misinterpret information found in scientific papers and cause a chain of events leading to the phenomenon of disinformation. For example, during the many experiments conducted early in the pandemic, some Australian researchers reported that under lab conditions, ivermectin had the potential to slow down the reproduction of SARS-CoV-2 in affected cells. The experiment was conducted in a lab under in vitro conditions with no human subjects. Many articles have used this study to justify why ivermectin can be used as a treatment against COVID-19. However, newly developed drugs require more rigorous research before they can be quote-unquote proven to be an effective treatment. Some have considered that this in vitro finding as evidence for why they should use ivermectin against COVID-19. However, a large international trial co-led by Dr. Edward Mills from McMaster University found that ivermectin had no benefits whatsoever in reducing hospital admissions. Yet, another study that is often quoted in online articles is one that was conducted in Egypt. The study looked into the effectiveness of ivermectin as a treatment for COVID-19 and ultimately reported that the drug reduced the number of COVID-19 related deaths in the country. However, the study was withdrawn over concerns of plagiarism and inaccuracy, which significantly reduced the validity of the findings. Unfortunately, this study has already been viewed over 150,000 times and has been widely cited, leading to an escalation of COVID-19 related disinformation that likely influenced the decisions of many. This brings us back to the initial pathway mentioned. So now let's use ivermectin as an example. We saw that flawed empirical scientific papers were published, which contain many limitations and/or inaccuracies. However, online articles and forums selected certain pieces of information and produced convincing arguments. Individuals like the one interviewed believed the information presented without fact-checking with doctors and proceeded to use ivermectin in a way that is unauthorized. And so we see that the web grows. The larger question we all have to ask ourselves is, what can we do? Social media is an ever-expanding network that continues to dominate the lives of many around the world. In 2021, the average person spends around 3 hours of their day solely on social media platforms, which is a 61% increase from 2019. In manners that relate to the health of not just an individual, but an entire community, where do we draw the line? Who do we hold responsible? And most importantly, how do we transcend the communication barrier so that everyday people are not believing disinformation about any topic, but in particular, their health?